Diabetes. Diabetes.
Diabetes is a serious disease in which there is too much sugar in your blood.
Diabetes is a disease in which the body cannot control the level of sugar in the blood. This frequently results from a lack of insulin, a hormone that the pancreas produces to help control blood sugar levels. Without proper insulin function, glucose builds up in the bloodstream and can lead to various health complications. Common symptoms of diabetes include excessive thirst, frequent urination, and unexplained weight loss. Regular blood sugar monitoring, eating a healthy diet, exercising, and taking prescribed medication are all part of managing diabetes.
Diabetes is diagnosed with a blood test. During the blood test, the doctor measures the amount of glucose in the patient's blood. If the glucose levels are consistently high, it indicates that the person has diabetes. Once diagnosed, the individual must work closely with their healthcare team to develop a personalized treatment plan. This may involve taking insulin injections or medication as well as lifestyle changes to maintain stable blood sugar levels. It is important for people with diabetes to regularly monitor their blood sugar levels and adjust their treatment as needed to prevent further health complications.
For example, he had developed diabetes and high blood pressure. In this case, the individual had developed diabetes and high blood pressure. This meant that his treatment plan would need to address both conditions, requiring careful coordination among his healthcare team. In addition to managing his blood sugar levels, he would also need to focus on controlling his blood pressure through medication, diet, and exercise. Regular checkups and monitoring of his health would be necessary to prevent any further health complications and ensure his treatment plan was effective.
Diabetes, also known as diabetes mellitus, is a chronic medical condition that affects how your body uses blood sugar, glucose. The hormone insulin, which the pancreas produces, tightly controls the levels of glucose because it is essential for giving your body's cells energy. When someone has diabetes, their body either does not produce enough insulin or does not use it effectively. This results in high levels of glucose in the blood, leading to various complications over time. It is crucial for individuals with diabetes to monitor their blood sugar levels regularly and manage their condition through medication, diet, and exercise to prevent further health issues.
For example, a person with diabetes may need to regularly check their blood sugar levels throughout the day using a glucometer. They may also need to take insulin injections or medication to help regulate their glucose levels. Additionally, they may need to follow a specific diet that involves monitoring carbohydrate intake and eating balanced meals. Regular exercise can also play a crucial role in managing diabetes by improving insulin sensitivity and helping to control blood sugar levels.
In diabetes, there are two main types, type 1 and type 2. Type 1 diabetes is an autoimmune disease in which the immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. This type usually develops in childhood or adolescence and requires daily insulin injections or the use of an insulin pump. On the other hand, type 2 diabetes is more common and is often associated with lifestyle factors such as obesity and a lack of physical activity. While some individuals with type 2 diabetes may need insulin therapy, many can manage their condition through oral medications, lifestyle modifications, and regular blood sugar monitoring. Regardless of the type, diabetes is a chronic condition that requires ongoing management and support to maintain optimal health.
For example, a detailed example of managing type 1 diabetes with an insulin pump involves a person wearing a small device that continuously delivers insulin into their body based on their individual needs. This allows them to have better control over their blood sugar levels, as they can adjust the insulin delivery according to their diet, activity level, and other factors. Additionally, they can also connect the pump to a continuous glucose monitoring system that alerts them if their blood sugar levels go too high or low, enabling them to take immediate action to prevent complications. This integration of the insulin pump and continuous glucose monitoring system provides real-time information about the person's blood sugar levels, helping them make informed decisions about their insulin dosage. Furthermore, the insulin pump offers convenience and flexibility, as it eliminates the need for frequent manual injections and allows for discrete insulin delivery. Overall, using an insulin pump can greatly enhance the management of diabetes and improve the individual's overall quality of life.
Type 1 diabetes. This is an autoimmune condition where the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. As a result, people with type 1 diabetes do not produce enough insulin and need to take insulin injections or use an insulin pump to survive. Insulin pumps offer a convenient and efficient way for individuals with type 1 diabetes to continuously receive the required insulin dosage throughout the day. This eliminates the need for multiple manual injections and allows for better control of blood sugar levels, reducing the risk of complications associated with the condition. In addition to providing a steady supply of insulin, insulin pumps also offer flexibility in terms of meal timing and physical activity. With manual injections, individuals often need to plan their meals and activities around their insulin schedule. However, with an insulin pump, they can adjust their insulin delivery based on their specific needs, leading to a more flexible and spontaneous lifestyle.
For example, a person with diabetes who uses an insulin pump can easily participate in activities like hiking or spontaneous outings without worrying about rigid meal and injection schedules. They can simply adjust their insulin dosage on the go, ensuring their blood sugar levels stay within a healthy range. This flexibility allows them to lead a more active and fulfilling life, free from the constant constraints of managing their diabetes. Type 2 diabetes. This is the more common type of diabetes and is usually associated with lifestyle factors such as being overweight, having a sedentary lifestyle, and having poor dietary habits. In type 2 diabetes, the body may not produce enough insulin or the body's cells may become resistant to insulin's effects, leading to high blood sugar levels. To manage type 2 diabetes, lifestyle changes are often recommended, such as adopting a healthier diet, increasing physical activity, and losing weight. Medications may also be prescribed to help regulate blood sugar levels. In some cases, insulin therapy may be necessary to help control blood sugar, and an insulin pump can provide a convenient and efficient way to deliver insulin. By using an insulin pump, individuals with type 2 diabetes can have greater control over their insulin levels, leading to better management of their condition and improved overall health.
For example, a person with type 2 diabetes may start by adopting a healthier diet, such as reducing their intake of sugary foods and increasing their consumption of fruits and vegetables. They may also incorporate regular physical activity into their routine, such as going for daily walks or engaging in cardio exercises. As they begin to lose weight, their blood sugar levels may start to stabilize, but if necessary, their healthcare provider may prescribe medications to further regulate their blood sugar. In some cases, if oral medications are not effective in controlling blood sugar levels, insulin therapy may be recommended. It is important for individuals with diabetes to monitor their blood sugar levels regularly and follow their healthcare provider's recommendations to manage their condition effectively. By making these lifestyle changes and following a comprehensive treatment plan, individuals with diabetes can improve their overall health and reduce the risk of complications associated with the disease.
Both types of diabetes result in high blood glucose levels, hyperglycemia, which, if left uncontrolled, can lead to various health complications. These complications can affect the eyes, kidneys, nerves, and blood vessels and may lead to serious conditions such as diabetic retinopathy, diabetic neuropathy, kidney disease, and cardiovascular problems. It is important for individuals with diabetes, whether type 1 or type 2, to closely monitor their blood sugar levels and take appropriate measures to keep them within a healthy range. This often involves regular blood sugar testing, following a balanced diet, engaging in regular physical activity, and taking prescribed medications or insulin as needed. By maintaining good control over their blood sugar levels, individuals with diabetes can reduce their risk of developing these complications and improve their overall quality of life.
For example, a person with type 1 diabetes may use a continuous glucose monitoring system to track their blood sugar levels in real time, allowing them to make immediate adjustments to their insulin dosage or food intake. Additionally, they may work closely with a dietitian to create a personalized meal plan that helps them maintain stable blood sugar levels throughout the day. Furthermore, regular exercise can also play a crucial role in managing diabetes. Engaging in physical activity not only helps control blood sugar levels but also promotes weight loss and improves cardiovascular health. The person may consult with a healthcare professional to develop an exercise routine tailored to their needs and abilities. By implementing these strategies, individuals with diabetes can take proactive steps towards managing their condition and minimizing the risk of complications.
For example, a person with type 2 diabetes may use a combination of aerobic exercise, such as walking or swimming, along with resistance training to improve their insulin sensitivity and lower their blood sugar levels. Additionally, incorporating regular exercise into their routine can also help reduce stress levels, which can have a positive impact on overall mental well-being. It is important for individuals with diabetes to prioritize physical activity as part of their daily routine and work with their healthcare team to ensure they are engaging in safe and effective exercises.
Managing diabetes typically involves a combination of medication, insulin or oral medications, and lifestyle changes, such as adopting a balanced diet, regular exercise, and monitoring blood sugar levels. It's important for individuals with diabetes to work closely with healthcare professionals to achieve good blood sugar control and reduce the risk of complications. Regular checkups and consultations with healthcare professionals are essential to monitor the effectiveness of medication and make any necessary adjustments. In addition, education programs and support groups can provide valuable information and emotional support to individuals with diabetes, helping them navigate the challenges of managing their condition. By taking proactive steps and staying informed about the latest advancements in diabetes management, individuals with diabetes can lead fulfilling and healthy lives.
For example, a healthcare professional may regularly monitor a patient's blood sugar levels to determine the effectiveness of their medication and make adjustments as needed. They may also provide guidance on lifestyle changes such as diet and exercise to help manage the condition more effectively. Additionally, support groups and education programs can offer individuals with diabetes a platform to learn from experts and share experiences with others facing similar challenges. These resources can provide valuable information on new treatment options, self-care techniques, and emotional support, empowering individuals with diabetes to take control of their health and improve their overall well-being. By making necessary lifestyle changes and following the advice of healthcare professionals, individuals with diabetes can better manage their blood sugar levels and reduce the risk of complications. Engaging in regular physical activity and adopting a balanced, nutrient-rich diet can play a significant role in managing diabetes. Furthermore, joining support groups and attending education programs can create a sense of community and foster a better understanding of the condition, leading to improved self-care and a higher quality of life for those living with diabetes.
Other terms for diabetes include gestational diabetes, adult-onset diabetes, and juvenile diabetes. These terms refer to different types of diabetes that can occur at different stages of life. Gestational diabetes occurs during pregnancy and usually goes away after giving birth. Adult-onset diabetes, also known as type 2 diabetes, typically develops in adulthood and is often linked to lifestyle factors such as obesity and a lack of physical activity. Juvenile diabetes, or type 1 diabetes, is usually diagnosed in childhood and is an autoimmune disease where the body's immune system mistakenly attacks the insulin-producing cells in the pancreas.
Gestational diabetes, in which a pregnant woman develops high blood sugar levels during pregnancy. This condition usually resolves after giving birth, but it can increase the risk of developing type 2 diabetes later in life. It is important for women with gestational diabetes to closely monitor their blood sugar levels, follow a healthy diet, and engage in regular exercise to manage their condition and reduce the risk of complications for both themselves and their baby. Additionally, working closely with healthcare professionals and attending prenatal checkups can ensure that any necessary interventions or treatments are properly implemented to promote a healthy pregnancy and delivery.
For instance, a woman with gestational diabetes may receive advice from her healthcare provider to check her blood sugar levels frequently throughout the day and adjust her diet and exercise routine as necessary. She may also be referred to a registered dietitian who can help create a personalized meal plan that supports stable blood sugar levels. By diligently following these recommendations, the woman can effectively manage her gestational diabetes and reduce the likelihood of developing type 2 diabetes later in life.
Adult-onset diabetes, also known as type 2 diabetes, is a chronic condition that affects millions of people worldwide. Unlike gestational diabetes, which occurs during pregnancy and usually resolves after childbirth, adult-onset diabetes requires lifelong management. This includes monitoring blood sugar levels, following a balanced diet, engaging in regular physical activity, taking medication as prescribed, and attending regular checkups with healthcare professionals. With proper management and lifestyle changes, individuals with adult-onset diabetes can live a fulfilling and healthy life while minimizing the risk of complications.
For example, a woman who develops gestational diabetes during pregnancy may need to closely monitor her blood sugar levels and make dietary adjustments to keep her condition under control. However, after giving birth, her blood sugar levels typically return to normal, and she no longer needs to manage the condition. On the other hand, a person diagnosed with adult-onset diabetes will need to continue monitoring their blood sugar levels, following a strict diet plan, exercising regularly, taking medication as prescribed, and regularly seeing healthcare professionals for the management of their condition. Adult-onset diabetes, also known as type 2 diabetes, is a chronic condition that requires ongoing attention and care. Unlike gestational diabetes, it does not go away after childbirth. Instead, individuals with adult-onset diabetes must maintain a healthy lifestyle and adhere to their treatment plan to prevent complications and ensure their blood sugar levels remain stable. Regular checkups and consultations with healthcare professionals are crucial to managing this condition effectively.
Juvenile diabetes, also known as type 1 diabetes, is a chronic condition that affects children and young adults. Unlike adult-onset diabetes, juvenile diabetes is not related to lifestyle or diet choices. It is an autoimmune disease where the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. As a result, individuals with juvenile diabetes require lifelong insulin therapy and careful monitoring of blood sugar levels to maintain proper glucose control. With the right treatment and support, individuals with juvenile diabetes can also lead a fulfilling life and manage their condition effectively.
For example, a teenager named Sarah was diagnosed with juvenile diabetes at the age of 12. Despite having a healthy lifestyle and no family history of diabetes, her immune system began attacking her insulin-producing cells. Since then, Sarah has diligently managed her condition by taking insulin injections multiple times a day and regularly monitoring her blood sugar levels. Through proper treatment and support from her healthcare team, Sarah is able to participate in school activities and sports and enjoy a normal teenage life while effectively managing her diabetes.
Someone with newly diagnosed diabetes mellitus has to learn to recognize the symptoms of hypoglycemia. Recognizing the symptoms of hypoglycemia is crucial for someone with newly diagnosed diabetes mellitus, as it can help them take immediate action to stabilize their blood sugar levels. These symptoms may include trembling, confusion, dizziness, and extreme hunger. By learning to identify and address hypoglycemia, individuals like Sarah can continue to live a fulfilling life, minimizing the impact of their condition on their daily activities.
Insulin products are widely used in the treatment of diabetes mellitus. There are different types of insulin products available, including long-acting, short-acting, and rapid-acting insulin. These medications are used to help regulate blood sugar levels by mimicking the action of natural insulin in the body. However, it is important for individuals like Sarah to work closely with their healthcare team to find the right type and dosage of insulin that work best for their specific needs. Regular monitoring of blood sugar levels and proper administration of insulin are essential for managing diabetes effectively.
In conclusion, it is important for individuals with diabetes to take a proactive approach to their health and well-being. By incorporating these lifestyle changes and seeking support, individuals can empower themselves to effectively manage their diabetes and live a fulfilling life. This includes regularly monitoring blood sugar levels, following a balanced diet, engaging in regular physical activity, and taking prescribed medications. Additionally, regularly attending doctor's appointments and seeking regular checkups can help individuals stay on top of their condition and address any potential complications before they escalate. Ultimately, by taking these proactive steps and seeking support, individuals with diabetes can take control of their health and achieve a higher quality of life.
This content is mainly for the purpose of learning and expanding your English vocabulary. We are learning American English. Thank you for taking the time to watch. Thank you for considering subscribing to see more exciting videos.